in fewer than 5% of patients.
Last year I saw 163 people for second opinions. And of those 163, we were able to treat all without extractions.
And what had they been told by the traditional orthodontist?
They had been told that they needed at least 4 teeth out and possibly then the extraction of their wisdom teeth after treatment. So that's nearly 8 teeth.
We've got a survey that shows that 60% of treatments done by orthodontists in this country are done without extracting teeth. Well, that looks very good.
Dr Jeff Wexler is spokesman for the Australian Society of Orthodontists and, not surprisingly, he supports the status quo.
40% of people in this country are having extractions according to your research.
It's not my research, but yes, according to the best research, which is very authoritative in the country.
But the Australian Orthodontic Society put its name to this study?
It's not their research. It will be published in due course, and I believe it belongs to the University of Adelaide.
So is Derek Mahony wrong in saying that the extraction rate in Australia is 80%?
Derek, no. He's just quoting you his own experience. And there are lots of different variations in orthodontic practices. That's normal.
Well, how about this example? 19-year-old Michael Buggy went to 6 Sydney orthodontists for his condition, some minor crowding. All insisted he lose 4 teeth. But his mother Valerie wasn't so sure.
And I was horrified because I didn't think that he had such a big problem. And I begged them not to take them out. I said, isn't there, in all the knowledge that you have and all the studying that you've done, isn't there another way? But they were quite steadfast that, no, the teeth have got to come out or the problem would come back.
Finally, Valerie gave in and took Michael to the dentist for the extractions.
And he was just at the point of having them out. She had all the tools in her hand. And she said, you don't want this to happen, do you? And I said, no, I don't. But what else can I do? And as luck would have it, she gave me this dentist's card and said, give him a ring.
That card belonged to Derek Mahony, and he straightened Michael's teeth without extractions.
I would like to actually show these orthodontists that said to me, you'll be back, you'll be sorry. I'd like to show them his smile now, and I just wish that orthodontists would get together and give any mother like me the opportunity not to have the teeth taken out.
Can I show you this patient here? Do you think he needs extractions?
Well, I wouldn't.
You wouldn't?
No.
6 eminent orthodontists recommended to this patient's mother that he needed to have the classic 4 on the floor.
What you've presented me here is part of the information. Based on what you've shown me, I wouldn't. But there might be other factors that you haven't shown me in this patient's diagnosis.
He's had very successful treatment with Derek Mahony without extractions. Does that surprise you?
No.
Are faces being damaged by traditional extraction-type orthodontics?
I haven't seen any evidence at all to say that faces are being damaged in general.
Try telling that to dentist Dr Mike Fennell. He pulled out 4 of his son's teeth on the advice of an orthodontist. The result, David's face ended up looking like this.
It ruined the look of his mouth. So from the nose upwards, he looked great, but from the nose downwards, he just looked terrible. But how do you tell that to your son? In fact, he looked like an old man. At the age of 18, he looked like an old man with no teeth in.
Is damaged the right word?
Yes, it is really.
Traditional orthodontics did that to his face?
They did, yes. Yes.
If you look at Zoe, what's caused all this crowding is really not genetics. It's more related to the way she breathes. And if you open really wide there, Zoe, big out, you can see that narrow top jaw, V-shaped arch.
Dr Mahony says the key is to diagnose the problem and start treatment at an early age. And the problem often starts here in the roof of the mouth. When children suck their thumbs or breathe through their mouths, it can be pushed in. And this narrowing can have a knock-on effect. The lower jaws force back and down, producing what most of us would call buck teeth.
We can treat as early as 6 and 7. The benefit of treating early is that we're working with growth, and as a result, we're making the space before the eruption of the teeth. So I think age is the most important factor that separates the new approach to orthodontics to the traditional approach.
90%